Welcome to Just a Dog podcast. I am your host, Nadine. In this episode, I'm joined by Julia Robertson, the founder of Galen Myotherapy and one of the earliest pioneers of canine myofascial and musculoskeletal therapy in the UK. Julia began this work in the mid-1990s, long before pain in dogs was widely understood beyond bones, scans, or obvious injury. At a time when dogs with unexplained discomfort were often labelled behavioural, difficult, or beyond help, Julia was asking a different question. What if the issue was not the dog's behaviour, but the body that they were trying to live in? So in 2002, she founded Galen Myotherapy, developing an anatomy-led approach to understanding pain, posture, movement, and chronic discomfort in dogs. Her work focuses on soft tissue and fascia, areas that cannot be seen on scans, but which strongly influence how a dog moves, copes, and shows up in everyday life. What sets Julia apart is not only her depth of knowledge, but also her philosophy. She works in a choice-led, consent-based way, allowing the dog to guide the treatment rather than be restrained or overridden. This conversation is about learning to notice pain, understanding agency, and to listen more carefully to what dogs are telling us through their bodies. Let's begin. I usually like to start with just kind of getting an insight into who you are as an individual. Before Galen Myotherapy, what was your experience with dogs?
I love it when I'm asked questions that I haven't been asked before. I begged my parents for a dog when I was probably around 7 until about 12. I begged. And interestingly, they had a book on dog breeds, because you would have a book on dog breeds. And they were always very deliberate, my parents. So they used to research things to within an inch of its life. And it used to drive me nuts. They go, can we have a dog? Please, can we have a dog? We're going to do our research. And funnily enough, we got a wonderful dog. But strange, interesting first choice, we got a beagle. Very interesting first choice. But the lovely thing is, I've still got that book with all the breeds that I used to just sit and look at when I was young for hours, wishing and praying that we would get a dog. So we did. So that was our first family dog. And then after, I mean, she actually lived for many years. She lived till she was 16, which was pretty good for a beagle. Yeah. And then my parents went on and had golden retrievers. Actually, they sort of went up a size, and I had a golden retriever. And then I was in Australia many years ago, and I met a Newfoundland, and that was it. That was it. So I've been lucky enough to have 2 new, along with some wonderful dogs with a lot of hybrid vigor. In other words, many crosses, and then Labradors. And I've had a miniature Dachshund too, who I loved, called Wellington, who was the most noble dog I've ever had. He didn't live long. Unfortunately, his desire for digging got the better of him. So that was horrible. He just disappeared. And then Labradors. And then I had a hilarious terrier cross called George. And anyone who met George remembered George, because he was a terrier with attitude. And since then, I've got a Labrador now. Sadly, lost a Labrador of mine last year. I'm still Labrador. Yeah.
And you're still grieving.
Yeah. She was, yeah. I mean, we're all lucky enough to have these amazing dogs. She is actually. But there are some that just get you. And she's been so involved with Galen, so involved with being a tutor at Galen, that equally, she was every part of my life.
How wonderful.
Probably one of the naughtiest dogs you could ever come across, because incredible sense of humor. Incredible. Yeah.
When you say naughty, what specifically?
She would confound things. If you're going, right, well, Maggie, we'll do this. We'll go that way. Oh, okay, we'll go that way. When I say naughty, I mean a mind of their own, and I love that. But we used to do all sorts of fun stuff. And one thing that I started when she was around 12 was scent work, and she really loved it. She really enjoyed it. She used to, the scent work where they actually lay the hides, and she used to go up to a hide and go, well, it might be there, it might not. What do you think? You're the one with the nose. Is it? Well, it might be. And then she used to do a rolly over just to get everyone's attention, to just entertain everyone. Yeah. So yes, I've
Sounds
been very
adorable.
spoiled. I've had some amazing dogs in my life. Amazing.
Yes, and quite the mix actually. When you said Newfoundland, I was like, since I can remember, that's been my dream dog. I mean, they're all gorgeous in their own ways, but like I just had a fantasy of one day having my own Newfoundland or Saint Bernard. And then I met a couple when I went to the Lake District one day. I think it was in Keswick. I went for a walk down the main road and I saw two gigantic dogs. And I was like, oh my gosh, I've only seen them in pictures.
Yeah.
And they're actually really
A
big
lot.
in real life, and they're slobbery and, like,
Do you know, both my Newfoundlands weren't slobbery at all. I mean, occasionally they had what we called air sea rescues that they had when there was a bit of food around. You say, oh, the air sea rescues are out. Good dog. You're always rescuing, always rescuing. But no, they weren't slobbery at all, which was quite something. I mean, they were both bitches, so they were a bit smaller. But my last one, Panda, she lived till she was 15. Yeah. And
yeah,
she was a fantastic dog. Weirdly didn't like water too much.
that's the antithesis of their breed, right?
Absolutely. Whereas
Yeah.
the first one, Snuff, she, whenever we went swimming in a lake or something, she used to come in and grab our arms and bring them back. Yeah. I
Quite the savior.
absolutely.
Oh, how wonderful. So, throughout that journey with so many different dogs, so many different breeds, personalities, was there a particular dog that shaped your view or led you down the path that you are today?
Yes, I mean all of them have, but one very much so, and it's quite well documented because it was such a moment. It was another Labrador, it was a yellow Labrador, and he was only 6 months old, and he had a fairly catastrophic accident where he couldn't lift his head. Now, he was staying with friends at the point when he had an accident, but I say catastrophic. It wasn't a catastrophic event, but it had a catastrophic effect. He couldn't lift his head and he was only 6 months. This is in the mid 90s. Yes, that's right, mid 90s. Then vets didn't have the facility, and there most certainly weren't any physios or anyone around for canine. And the vets didn't have the facility to investigate such oddities. And it was odd because nothing showed up on imaging. They couldn't work out what was wrong with him and why he couldn't lift his head. And as I said, he was only 6 months old and he couldn't stand up properly. I had to help him up. So I was sleeping downstairs with him and he wasn't improving, just wasn't improving. And at that time we had a couple of vets that came out for to look after the large animals. But then I asked, because I went to every vet around me, and I asked him to come in and say, "Could you please have a look at my puppy? I don't know what is going on. Please help me." And all he did was look at him and say, "Well, he's hurt his neck." And it was, "Oh yeah." And we had gone down so many rabbit holes, literal, but academic, if you like, going, well,
Yeah.
it could be this, it could be that, it could be this, it could be that. It could be, rather than just going, he's hurt his neck. And I've always had fairly a variety of musculoskeletal issues. So I thought, well, I can incorporate some exercises to try gentle rehab stuff. So I started just asking him to lift his head with a lure of a biscuit. And he went, I could do that. And within a week or so, he had managed to lift his head because I was told I was going to have him put to sleep because there was no cure. So from there to this, so he very much showed me the whole direction of my life. It wasn't just a small hint. It was this is the way you've got to go, because it ended up to be a soft tissue problem and soft tissue discomfort and restriction. And there was no one then that understood that. It's very different now, thank goodness. But it led me to have all sorts of horrific nightmares about how dogs could have back spasms and neck spasms and how they could be actually recommended to be put to sleep. Now, I've had both of those, and I'm sure many people have, but they are agony. But there's no desire to die. It's not, it's something that could go. And that's where it took me. And I thought, I've got to find a way of treating these dogs and working out how these dogs can be helped. And of course, that was years ago now, years ago. So it eventually led me, after a lot of planning in different directions, both professionally and personally, to starting Galen Myotherapy in 2002, specifically to help these dogs with soft tissue problems, or muscular or myofascial or musculoskeletal, all the same sort of thing, problems which are incredibly painful and can be the direct result of an injury, or they can be compensatory from another effect, like a skeletal issue, like something common like hip dysplasia or knee problems or anything else, or something like a repetitive strain, which so many of our dogs do suffer from.
What did you do before that?
Well, actually, I farmed before that, so I've been always working with animals, always. And I think that has definitely led into a lot of the foundation work within Garland, because when you're working with livestock, the best thing you can do ever is just observe. And so observing your dog, and observing animals, just observing, just taking the time. It's the best thing you can do to really understand them. And that's sort of what Garland's been built on: observations and getting information from the dog and asking the dog, without literally in English asking, but asking what they need. And then putting that scientific bit in to bolster and to support everything.
Wonderful. How so just quickly going to, the soft tissue, the myofascial and the
Musculoskeletal.
musculoskeletal. What are they for people that might not know? And especially talking about dogs, if you had to compare dogs to humans, like how can we identify those parts in ourselves?
Okay, well, the anatomy is directly transferable from the dog to the human, and the horse to a degree too. So we've just evolved to stand and move in different ways. But a lot of the same muscles are the same as they are in us and dogs. And weirdly, but then again, not. When you know about functional anatomy and how the bodies work, it's not that unusual to understand why we have the same sort of problems. So a lot of humans have a lot of neck problems, so do dogs. A lot of humans have lower back problems, so do dogs. And it's because these are our vulnerable areas, or the areas that are used the most. And so our anatomy and our functional anatomy, sort of, really, you can compare the two very, very easily, even though we walk on two and they walk on four legs. So, and often the issues are the same. We put a lot of load through our shoulders from doing a lot of this work, and dogs put a lot of load through their shoulders and neck, because often they protract their weight forwards in a compensatory fashion. What do I mean by muscles and musculoskeletal and myofascial? So we all know that we've got muscles, but actually there's been a lot more work and a lot more science coming forward, which is really great. But it's something at Garland we've always looked at, is the actual fascia that lies in the body. So without wanting to make people squirm, if you have a joint of meat, all that white that you see between all the different areas of the actual sort of meat itself, that's fascia. It's a lot more complex than that, but it's basically a connective tissue. And to put it in very broad, easy terms, it joins muscles together to form functional lines. So to perform an action, it used to be that we used to just, look at our biceps here and our triceps. One is to flex the elbow, the other one is to extend. It's much more complex than that, because to do that, you then have to stabilize your shoulder and stabilize your spine, even your hips, if you're standing up. So you need these functional lines to be able to work, to be able to perform different movements. And that's one of the many roles that fascia does. And it joins these muscles together to create wonderful sort of connective forces. So we're much stronger. We don't just use one muscle, we connect everything together. And that's why it's important for us to move in a very balanced way, so we can use all these wonderful joined up muscles to be able to move in a biomechanically efficient way. So it's very much the same.
How can regular guardians support their dogs in ensuring that their fascia is performing optimally?
Fine.
Healthy. That's it.
Fine. And it is a new way of looking at all of us. And it's so good that as Garland, we've always looked at the whole dog. And this is the thing. You've got to look at the whole of your dog. And if they're lame on one leg, it's not just that one leg, it's going to affect the whole body. So there are so many things that you can do. Firstly, it's really try and prevent repetitive strains. And that sounds really easy. Well, I'm not going to do this or that. But actually, repetitive strains happen primarily in the dog's house, in their home. One of the worst things are slippery floors. If your dog is on a slippery floor, it's something at Garden we've been talking about for years. So the best thing is to look in the environment to start with, because that's one of the most common causes of repetitive strains. And that actually is a slippery floor. And I don't think people really quite understand how bad that is. That is probably number one, apart from repetitive ball throwing, that is going to really have a big negative effect on your dog's soft tissue, myofascial connections, or whichever way you look at it. It can be so detrimental. So on our website, we've got a free download for looking at that. So you can actually understand a little bit more about why that is so detrimental. So the environment, for one thing. So slippery floors, huge. I mean, try your dogs not to leap on and off the furniture too much. It's what they're leaping down onto. If they're leaping down onto a slippery floor, it's just so bad. So that's one thing. Exercise, obviously, is another. And there's so much we can discuss within this. Dogs don't need masses of exercise. I think we've all been conditioned that they need so much, marching down the pavement. Firstly, they need variety, and they definitely need their nose. And to enable your dog to be able to sniff freely is huge, because then they do the multi-directional movement, which is really important for an all-round muscular activation and development. So important. And a nose down really helps strengthen those back legs, which is really important to maintain that through their life. So exercise is massively important. Something that dogs find very difficult to cope with is to have very long weekend walks and then very little during the week. They're just not fit enough. And you, as a marathon runner, you would completely understand that you can suddenly get up and right, we're going for a 15-mile run today, and you'll be fine. There's no preparation, there's nothing, but you can recover through the week. You'll be so sore through the week. And it's just, if you're going to do that, make sure that your dog has been conditioned for it and is appropriate for that sort of walking. But also that you can't just do it 2 days and then nothing. It can be quite damaging. So it is all about just trying to think how that would feel for you. Likewise, things like running with your dog on a lead, unless you're fully trained and got the right equipment and you're doing it through a trainer, that also, I see a lot of people running with their dogs down the pavement, and they're going for a lovely run, but their dog's got no choice. And their dog's running and they're going, oh, but their dogs love it. They don't actually have a choice. So it's better if the dog can be off the lead, but obviously that has safety issues. Likewise, cycling with a dog, they don't have a choice. So it's just trying to reverse that and go, how would I like to go running with someone that's got legs that are 3 times longer than me and are probably doing interim sort of training, and I'm being taken along with no choice of where I go. I haven't got a voice as to how it feels on my feet, on my body. So it's about just thinking about how it would feel for your dog too. Those are some of the main things. I think, as I said, the environment is so important, but also what we do with them outside of the environment too. If you have the ability to be able to take them somewhere where they can sniff around trees and things like that, I mean, that is just so good for them, so good. And they don't so much want to be tired physically, they want to be fulfilled. So they want to come home and they want to be fulfilled and go, that was great. I've caught up with that one, that one, that one, that dog, that dog. I now know what's going on. I'll have a nice sleep, rather than come back and they're so wired that they can't settle. And that's a big thing in puppies. But also, I think people are much better now at thinking, actually, it's my dog's walk. It's not my walk. If you want to go for a long walk, go for a walk, but you don't necessarily need to take your dog. They may not want to come. I wish that we didn't call 8-year-old dogs veteran. I wish that we started calling dogs that were sort of 12. Okay, you're mature. You're mature. Because, as I said, I had a 15-year-old Newfoundland. And okay, that may have been a lucky fluke. But I think if you can keep a body fulfilled, exercise, not overweight, obviously, looked after physically, quite often mentally, they're a lot more secure too. Because the two obviously go together. If they feel fit physically, they're going to be much more confident. Confidence is so important. Physical health is so important. And the more we're finding out about fascia, the more we realize that it has a direct impact on our autonomic nervous system. So it's the rest, the digest, it's the fight, flight, also on our digestion, on how we process things. Just, it's so completely global. So
Mhm.
the physical side is incredibly important. And obviously the psychological side is too. And things like if you feel like you haven't been able to get out, the weather's wrong, or you're not feeling great or whatever, you can do a wonderful enriched environment in your home or in your garden, and where you can put some objects down and maybe put a couple of treats in there. I love it. It's really like hide and seek, but with
Mhm.
rewards. And they really love that. And we use that a lot in rehab because it gets the body to move and change, and it gets their neck to move, to sniff round corners, which they may not do on a standard walk. Because if they're going on a standard walk without any real breaks, they go in one plane of movement, and that's not a healthy thing. And also, by just walking your dog, you don't actually walk your dog. Your dog has been trained to trot and walk. 4-time walk, as a person, you'll have to walk really slowly. So that's another reason why sniffing's so good, because a dog will walk. Walk is such a healthy gait for a dog, as it is for us too, but more
Mhm.
so for a dog, because at a trot they go on the diagonal. So if they've got an uncomfortable area, they can avoid it, which has its purpose too. But if they're walking and you bring them up as a puppy to walk, they load each leg separately and independently, and that creates great forces going through the body, really healthy forces, and great connections too. So a walk is really, really powerful.
Do you see much in terms of the effects of collars, harnesses, that type of thing on dogs and injury?
Yeah, I mean, it's such a huge topic, huge. And sometimes I think people think I'm a bit controversial, but firstly, it's about safety, absolutely about safety. So if we didn't have to keep our dogs safe from roads, other people, other dogs or whatever, they wouldn't have anything on. But they need to, because we need to keep them safe. And then if we are using anything like a collar or a harness or whatever, we need to know how to use it. And as far as a harness, we need to know how to fit it. So as I said, I wrote a puppy book, and in it, I put down all the different types of mechanism that can be used and what effects it has. So a collar, if you just put something around a collar, a leash around a collar, clip it on, and the dog doesn't pull, it really isn't going to do a lot of harm. The moment the dog pulls, that's when it's got the potential for harm. And likewise, a harness, if you put a harness on, if all the limbs can move and everything is free flowing, but you're not pulling, then that's a good harness. But the moment you put any restraint on the harness, you've got to check that that harness fits in the right place. So I only use harnesses with my dogs, but I make sure that they fit them. If you've got a horse, you would never just grab any old saddle and put it on because it's a saddle and go, well, that'll do, because it wouldn't fit that horse's back. The thing with dogs, as we all know, they come in all shapes and sizes. But the main thing is that you want a harness. If you're going to use a harness, which I believe is better for a dog, as long as it's safe, and especially when you're talking about the sight hounds with the deep chest, you've got to make sure you've got that extra strap so they can't wriggle out of them. You've got to make sure that they've got room to move their legs and that there's no restriction across the chest, because they do need to move freely, because after a while that's going to feel sore and restrictive. But also, for me, one of the most important things is that it fits here, because most harnesses fit here. They sort of go up from a Y there or whatever, but it's here. Now that's fine, but then you've got to test it when you put a bit of restraint on the harness. And then you can try it, and I think this is such a good thing to try. If you
Mhm.
push here on your clavicle, now obviously a dog doesn't have a clavicle, but they do have a chest bone. So if you push really hard there, so you're really straining into the leash, it's uncomfortable, but it's okay, isn't it?
Yeah.
So if you now just go up a centimeter and push,
Oh,
that's a
yeah.
very different scenario. And that harness will be lying flat, and then when you're pulling, it would do that. And a collar would do that, which is so
Awful.
unpleasant and so damaging. But the harness too could potentially do that too. So, and it doesn't matter about the padding, the fluff and everything around. You've got to check that when you've just put a bit of restraint on it, it doesn't do this. So it really does have to sit on that sternum in a very comfortable way. So it is difficult. It's really difficult. There's not one fit for all to actually get a well fitted harness for your dog.
What is What is the impact of an ill-fitting harness, especially when it comes to the majority of us who don't have your training, aren't able to identify when our dogs are in pain or have kind of long-term injuries or pains or niggles or stiffness or whatever. So, what are some of the effects of choosing either ill-fitting or the wrong types of harnesses or collars for our dogs? Like, what could that result in?
Well, you could look at it another way. You're putting the collar and the harness on, so you've got a control to keep your dog safe. And that's one thing. But is your dog pulling? If your dog is pulling, then please go and see a good trainer that will help train you to enable your dog to walk in a more relaxed way and probably on a longer leash too. And then you can look at the harness as well. So the dog might be avoiding whatever they're doing by pulling. So that is probably one of the first things we need to know how to walk with our dogs. There are some really good trainers now. And if you say, please, will you train me to walk with my dog with a long lead, that would be a good start because actually that enables the dog to move in a much more natural way. Long-term effects, the long-term effects are about the pulling. And sometimes people, well, yes, the neck, without doubt, the neck, that is not great. And you just need to do that to yourself and you can feel how uncomfortable that is. But it's more about the pulling itself on the dog's body. It becomes a repetitive strain. So it's not just about the front at all. If you're walking behind a dog and your dog is pulling, you look at the orientation of those legs. The back legs are not like that, they're like that. And the front is but the back comes out. So they realign their alignment within the hip socket and they're putting a lot of force through there. And if that's repetitive, that's going to change the whole structure of your dog's back end potentially because it's going to create different patterns of movement. And by the alignment or being misaligned, it could potentially create secondary issues because that is not how the dog's legs are meant to fit within the hip or the knee, and it will affect the back too. So it really is incredibly important to find a very good dog trainer that will help you with your dog. It's not train your dog, train the person.
Yes, absolutely. You're one of the first people to communicate it from that
Definitely.
perspective.
Got to understand your own dog and you've got to understand their motivators too. And behaviorists and Galen Myotherapy work together all the time now. And it's so great. It's like this, and dog trainers too. We all work together now. It's because we understand that these things don't come in silos. It's not about the physical health, the emotional health, how to train. It's about the whole thing. And this is what's so great.
Do you have a kind of like a mission or a central thesis in the work that you do that pushes and drives you forward?
I think choice, that's our big, big, big thing. And that because we use the choice-led treatment, it's called Positive Pact. It's something that evolved over years of treating dogs and me observing them and going, well, hang on a moment. If they move away from where I'm treating them, if I follow them, they're just going to be stressed. Or if I give them treats, they're not going to be focused on me and what I'm doing with their hands. If they're doing what their guardians tell them to do, like sit, stay, then they're not going to be concentrating on me and they're not going to have autonomy over their body. And if they're treated in a place where they can't move, they're not going to be able to move away. So choice is massive for us. To give the dog autonomy is just the best because that creates a trusting, authentic relationship. And so we treat using choice. And I think sometimes some people, when they question us, go, but how can you treat a dog that is in pain with choice? Well, we do because we don't necessarily treat the painful area, but we're treating an area where they go, oh, yes, I need that. And that unwinds them. I mean, we've got so many photos befores and afters and all sorts to show that it works. So we treat dogs that can't be touched. We treat dogs that have a bite history. We treat lots of dogs because we give them a voice and we go,
Wonderful.
if that isn't great, what would suit you? And you've got the time. We have the time to be able to do that. And we factor the time in our treatments. Even with our treatments, but also our rehab exercises too. We use ways that encourage dogs to do something, but it's all natural movement patterns. It's all foundational. So choice and natural stuff, I would say. It's really, again, through all those observations, how should a dog move and why can't they move like that anymore? What could we give them to help them reestablish those old patterns? So first we need to remove the inhibition or the something that's restricting that whole sort of line of movement. And then you encourage them to do these movements to rehabilitate that movement pattern that they've lost. But that we use just through functional movement. So it's the type of movements that they would normally do.
Well, how would a regular dog guardian know if there was cause for concern or know when would be appropriate to contact a Galen myotherapist in their area?
I think really what we hear so often is that someone knows that there is something not right with their dog. It's just they just don't feel that they are right. And they may go to a professional and they go, no, 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 they're fine. And we have to work with vets, and vets are amazing at what they do. But sometimes they don't have the time to actually do that detailed physical analysis. So I would say, first off, I would say that the guardians have an idea. They know because they know their dog so well. I mean, who knows their dog better than someone that lives with them? So if you've got an inclination that there's something not right, it could be a behavioral change, and that might not be behavior. It could be driven by discomfort or pain, of course. You just need to think about yourself with a headache. I mean, if you've got a headache and there's a lot of noise, would you go, this is fine. I can cope with this. It's only a headache. It doesn't affect me. Or if someone comes a bit too close to you and you've got a headache and you just need your own space, are you going to say, I'm really sorry, but I've got a bit of a headache. Would you mind staying away? Or would you say, please stay away? It's got to be minimalized because you've got to contain yourself. So it's those things that the guardians notice. And sometimes it's difficult to quantify because it could be that the dog stopped playing, but never picking up or not picking up a toy is this sort of insidious thing that one day they may not, and that's fine. And then they'll pick it up the next day because they might feel a bit better. But then a week later, they don't pick it up for 2 days. And then it gets more and more until you've forgotten that your dog used to play or whatever it might be. So there are many different observations that you can't quantify. You're going, there's something not right. So what I suggest you do is try and find a photo, an old photo. If you had your dog as a puppy, go back to when they were just a bit beyond adolescence and see if you can find a nice photo, perhaps of them standing a side view. So you're sort of doing a bit of a postural assessment. And now take a similar photo and look at their balance, look at their symmetry. Have they become very shoulder heavy? Has their back end lost muscle? Is their top line, is it like that, or is it flat, or is it curved? Do they wag their tail? Have they stopped wagging their tail? I know that sounds very odd, but that's another thing that can change very slowly. If their tail position has changed, has their head position changed? So photos are brilliant. Videos are great, but honestly, if you can find an old photo of your dog standing sideways and then compare it with one today, wonderful. Then you can look at the posture and the balance change. So that's one thing. The other thing you could do, if you were interested, again, go to our website, which is galenmyotherapy.com, and there is a comfort scale that you can download, and you can actually fill in the answers, and you can work out, you don't need to know what the percentage is, but you can see how often you write, yeah, my dog does that. Yeah, my dog does that. And there are questions in from different facets of your dog, digestion to the physicality to other behavioral sides and other things that you may have noticed. And you can have a good idea then of your dog's comfort. So that's quite useful. And then if you are particularly worried, and you feel that there isn't a therapist like Garlemeister or a therapist around, we have a distance support program where we do a full postural analysis and full report and gait analysis, and then give you a supported massage program so you can treat your own dog all under video supervision and everything else. So that's a nice thing to do.
What is the best solution for a guardian who wants to just have their dog feel more comfortable?
Yeah, I mean, the distance support is fantastic because that's very specific, and we will be looking at that particular dog with that condition. If it's more generic, we've got this great online course, which is Introduction to Massage on the course. Also, some of our therapists run some brilliant introduction courses. Some of them are in person, some of them are online. So I would definitely sign on, keep an eye on our Facebook, but also on our website. So you've got two real options there: the online course or the distance support, very specifically for your dog. And going back to your dog, I think a really quite an easy way of just looking at your dog and thinking, are they right or not? A dog has got to be symmetrical and balanced. So if one leg or one foot is turned out and the others aren't, then that is not a symmetrical, balanced dog. You're absolutely right. That's a comfortable way for your dog, but why is your dog uncomfortable and have to sit like that? Yeah. And the other thing is, just because your dog has been diagnosed with arthritis, but that means that there will be a muscular implication. So whatever the lameness is, the muscles and myofascial connections are always going to be affected. And in our experience, I've treated thousands and thousands of dogs with osteoarthritis, and they've all felt the benefit because of this compensation. And the compensation can sometimes be as painful, if not more painful, than the actual arthritic joint. And that's only from my experience. That's not a clinical trial or anything. That's just from what we've seen, from the dogs that have come in to the dogs that have finished their programs.
Mhm. Yeah, I was just thinking, you said the word lameness, and I don't think I have a full understanding of what that actually presents as and what that means. In my head, lameness means it doesn't work anymore.
A lameness can be so many different levels. A lameness can look like that as a waddle, or a lameness is when they really dip through their leg, an extreme lameness. I mean, you can do it in 1 to 10 tenths lame, but a lameness, we see more dogs that aren't actually lame. They're lame, but they're uneven. So they're offloading. And so they look labored in their movement. The movement, again, we do lots of training with movement and gait and everything else. And I would say that movement is a visceral experience, I think. If you see someone running that is a good runner, it's just, wow, it's pleasing. You want to watch it because it's congruent, it's balanced, it just looks spectacular. Watching any animal run beautifully is just fantastic. And it is visceral. But when you watch any animal or person move or walk that is unbalanced, it just makes you go, oh, there's something not right there. And that's the point that I would go to and go, oh, no, that doesn't feel good for me to watch. And that might not be a lameness as such. It's just more about the dog being unbalanced or moving in an irregular way that creates this imbalance in their whole movement.
Yeah, it's such a skill, isn't it, to be able to identify when the gait is ever so slightly off.
Yeah.
Do know when she came to me, she didn't have her diagnosis. I saw her run across a field on the lead, and I saw that it was like almost like step, and then a double step, and then a regular step.
Yeah.
And I was like, something's not quite right. So I actually filmed it and then I slowed it down and I could see the compensation, as you call it. And I was like, oh, okay, we need to take her to the vet.
Yeah.
And
That's
it was accurate, thankfully.
great that you took that so seriously and you trusted yourself. It's really good that you trusted yourself and you got a good response when you went, a supportive response. Brilliant.
Yes, yes. Well, it was quite a relief because the thing is, when you've got a new dog, especially a rescue dog, you kind of don't understand what circumstances they do. You don't know whether or not her separation anxiety is because she's actually in pain or because she has attachment issues.
That's amazing that you've really tried to think about things like that. It's brilliant. But also people should do that when they get puppies as well, because when a puppy arrives, they might be 8 weeks old and everyone thinks, well, I mean, obviously they're perfect. All dogs are perfect. This perfect puppy, there'd be nothing wrong with this puppy, but there could be. So I think we've always got to be just aware if we're really, really keen to be in touch with our dogs is just always observe them from a very objective view and go, that doesn't look quite right. And just because they're a puppy, it doesn't mean to say they'll grow out of it or anything. They may not, because there's been a lot of time, 8 weeks for injury, and maybe they got squished when they were in the uterus. Who knows? So we just got to be less closed-minded and more open-minded about potentially there might be something not quite right.
Yeah. Oh, so good. Okay, quick fire round. What is the
Mm.
first dog you remember clearly, and what did they teach you without even trying?
Okay, well, my first dog would be the beagle that I got. And what did she teach me? She taught me how incredibly stubborn some dogs can be. But also just how for me, a family is not complete without a dog.
I agree with you. What is one everyday behavior in dogs that humans consistently misunderstand?
I think there are so many, but I think one of the big ones is that their nose, they're sniffing. I don't think, because we don't do it to the extent or have the ability, we don't get the importance of it and the importance of how they want to sniff things and how we should encourage them. And the more we encourage them to use it, the more refined it gets. And then the more refined it gets, the more we learn from them, anticipating and looking at different situations. Fantastic.
What is something that dogs do better than humans without effort or training?
Express themselves. They are so honest. The honesty can be quite alarming at times, because we filter so much, which is good and a shame. And sometimes dogs are so wonderfully honest. It's that vulnerability of their honesty. But that would be it. It's how they feel now is what you get.
Yeah.
You
And
give dogs oxygen in the morning and they're happy.
that's so true. I think it's that honesty
Yeah.
that has the power to heal us.
Oh, it's overwhelming. It really is. And yeah, we should learn much more about living. If it's good now, then it's good. Living in the moment.
What is a question about dogs that you think more people should be asking?
What does my dog want?
What do you notice first about a dog when you meet them?
That's a difficult question, because obviously I sort of do this visual assessment. I now try very hard not to. I just look at their face and how they look at me, if they're looking at me, but their whole approach. Yeah.
Gosh, that must be so stressful to know so much. It's a blessing and a curse, isn't it?
It's a blessing and a curse. It really is. And so many people that come on our courses, at the end, I apologize. I say, I'm really sorry. You'll never touch another dog again, because you will just go, oh, how do they feel? Or you'll never observe another dog in the same way again, if they're doing the posture. So it is very difficult. What do I observe? I observe my feel about a dog. I get a very strong feel about each dog I meet, and it feels like their personality and character comes before them, and that's probably more than anything.
So quite intuitive as well.
I think so. The thing is, you don't know, because that's what happens. I don't know whether that's intuitive, because I'm only me. I don't know what other people feel, but that's what I feel.
Yeah.
And then it's reflected through their face.
Wonderful. What brings you the most quiet joy when you are with a dog?
Peace, for one thing. It's his authenticity. That is what it is. There's nothing. There's no message underneath. I can't think of the expression now. There's no subtext. There's just text, and it's wonderful honesty, but also the fact that at night time they are on such wonderful form, and they say good night, and you go to bed, and it's wonderful. There's no bad feelings. And you wake up in the morning, it's good morning. It's joy and peace and happiness and everything else. Other slightly cliche type things, but it's true, isn't it? It's true.
Yeah. Well, they are as popular as they are for a reason, right?
Exactly.
It's all in the numbers. If you had a magic wand that would change something about the dog world in an instant, what would it be and why?
The dog world. Okay. There are a few things. I think one thing what would be really great is for people, before they take on a dog or a puppy, that they should do some sort of exam. I know Switzerland's brought that in, some sort of questionnaire. Or if they don't know, they should go on a course to learn a bit about dog behavior, how a dog, I want to say dog training, but human training, as I said before, and also the importance of physical health. I think we go into these things, there is education out there. It should be encouraged, or, I mean, it'd be lovely if it was, I don't like legislation, but it should be heavily encouraged.
I
And
agree. I back you on that one.
yeah, absolutely.
Yeah. I
There's so much education out there now. I mean, you doing this wonderful podcast, there are so many that offer so much from every perspective. And if I would love it if people were more proactive about finding out a bit more, and not when they've got a problem, to more negate those problems if possible.
Wonderful. Thank you so much, Julia. I really appreciate your time, and this conversation was incredibly insightful. Thank you so
Well,
much.
thank you very much for inviting me. Thank you.
My pleasure.